Indeed, plenty of opportunities right there for Kenyan companies in Barbados, especially in the tech sector. But every Tuesday, you grab the Standard newspaper, there is a gem inside it, and we call it the Financial Standard. Now, the top story, of course, has been Nairobi Expressway puts PPPs to test, and that is quite an interesting story. But when you turn the pages, at the end, actually page 7 of the Financial Standard, there's a story written about hospital visits. Unnecessary hospital visits add to health insurance cost. And this brings us to quite an interesting discussion where insurers have cited dental and optical as the most misused cover, with beneficiaries seeking needless services to justify premiums, while some service providers also are culpable for ordering gratuitous procedures. I'm now joined by our writer and the writer of this particular story on the Financial Standard, Graham Kajilua. Graham, this is basically abuse of insurance, if I'm not wrong.
Definitely it is, because most of the patients, I don't know if we should call them patients, they go to hospitals not necessarily because they're sick, but because they feel they have not used the insurance covers well according to their own standards.
So they say there is an element I have to utilize, the cover to the maximum. So you enter a hospital and you just instruct, oh, most probably my eyes are not feeling good. You give me a test. Is that how it goes?
Yeah, definitely not, because according to the doctor, or I'll call him the CEO for Jubilee Insurance Health Limited, he noted that dental checkups and optical, when it comes to outpatient, those are the major services that people go to seek just for the sake of. When it comes to inpatient, a cesarean section is the one that is being misused, and in this case, we can refer it as a mixture of abuse, misuse, and sometimes overuse of covers.
The balance between these two, Graham, there is the patient responsibility, the policy holder, and there is also the part where the hospitals do play. When you see this abuse, where is it coming from, and is there an element that could be controlled?
The abuse actually comes from both sides, because from the patient side, it's definitely out of ignorance. That's what the doctor said, because the idea behind insurance, as he explained very well, is insurance is the only service you can get service of worth 1 million shillings from just 10,000 shillings. So when a patient buys an insurance for 10,000 shillings, at the end of the year, they feel they have not utilized any shilling, even the 10,000 that they paid as the initial premium. So they feel they need to utilize these 10 shillings and as well utilize the 1 million shillings that they feel they are entitled to.
Yeah, and looking at the figures, actually 712 million shillings. This is the amount of money insurers have paid out in the last 3 years for C-section procedures. And this is quite a sensitive, medical procedure. Looking at it, from which side does it come from? The hospitals, sort of, quote unquote, I won't call it coercing, but, advising their parents to take, their patients rather, to take C-section?
In most cases, it ends up that it's the hospital that suggests to the patient to have a C-section. You understand, when an expectant mother is giving birth, they are almost in a desperate situation. And when such an easy option is, I wouldn't say it's easy, but such a less painful option is given to the patient, they are definitely going to take a C-section. And also we have to understand that when it comes to the National Hospital Insurance Fund, reimbursement of the money that is paid to hospitals. When it comes to normal delivery, the National Hospital Insurance Fund just pays 10,000. But when it comes to Csection, the price goes up 3 times to 30,000. So when a hospital, even from the business point of view, you look at it, you realize if you do a lot of Csection to as many women as possible, you're going to make as more money as you can.
And that, on the flip side, it's quite unfortunate because, I mean, for health purposes also, that puts the patients in sometimes critical situation with the motivation of getting more money at the end of the day. But also looking at this figure of 12 billion shillings, where you say this is the total payout by insurers in the second quarter of this year under the medical segment. I mean, medical, insurance, it's booming. Shouldn't the insurers be celebrating, I mean, balancing the claims vis-a-vis the collections in the medical section of the insurance? How do you, what is the observation?
For many years, I think before 2020, the insurance sector, particularly the medical insurance, they haven't been making a lot of money. And this is because one of the reasons is because there's been the issue of the Csection abuse and overuse. And sometimes doctors or the clinicians at the hospital prescribe original medicine instead of generic, which work as good as the original, which ends up increasing the cost of medical care. So, but actually last year, I think there was an improvement in how, in the profitability of medical insurance, because one of the reasons is the COVID-19 pandemic. We had very few people going for hospital visits. So at the end of the day, there were less claims by insurance companies. But it's a very tricky balance to put when you look at the payouts and the actual claims. That are they as genuine as they seem to be? Is the patient as sick as they claim to be? And is the hospital or the doctor who is attending giving the prescribed treatment that is relevant to that condition that the patient has? It's still a very thin line.
Quite foggy right there. So briefly, as we close up, what is the solution, especially from a patient's side? Is there more need of education on matters insurance, and also on the hospital side? What can be done to prevent this misuse and abuse?
Definitely from the patient side, there is need for more education, because it is believed a lot of people do not understand how insurance is supposed to work. Insurance is supposed to cover a risk, and you're not supposed to create a risk so that you can be covered. Also, in terms of on the side of the service providers, that is the hospitals, it is important that technology is adopted, and already we've seen this in many of the insurance companies. When someone is admitted in inpatient, one of the officers from the insurance company that is covering the patient actually goes and does a hospital visit